eosinophilic gastrointestinal disorders, or EGID, stands for eosinophilic gastrointestinal disorders, and are a group of chronic immune system disorders in which a type of white blood cell, eosinophils, build up in the gastrointestinal tract. This buildup of eosinophils is associated with inflammation, injury, and dysfunction of different parts of the digestive system. The diseases are caused by allergic responses, in which allergens, such as common foods, trigger immune cell activation and inflammation. Unlike classic food allergy, such as peanut anaphylaxis, the allergic response is not immediate and typically not life-threatening. Rather, the response is delayed and associated with chronic inflammation and intestinal symptoms. Eosinophilic esophagitis, or EoE for short, affects the function of the esophagus, the tube that connects the mouth and stomach. It is the most common EGID. However, there are other eosinophilic conditions that affect the gastrointestinal tract. These conditions are named for the organ of the body where excess eosinophils are found. Eosinophilic gastritis, or EOG, affects the stomach. Eosinophilic enteritis, or EON, affects the small intestine. Eosinophilic colitis, or EOC, affects the colon. EGID can occur in both children and adults and involve severe inflammation, resulting in problematic function of these important parts of the body. A patient can be diagnosed with having one or more of these conditions. Patients can have various symptoms, including vomiting, abdominal pain, difficulty swallowing food, growth issues, anemia, fatigue, and diarrhea or constipation. EGID is diagnosed by examining tissue samples from the gastrointestinal tract, esophagus, stomach, small intestine, and colon. A doctor will perform an upper or lower endoscopy depending on symptoms. An upper endoscopy involves a small lighted tube being directed through the esophagus, stomach, and part of the small intestine. A lower endoscopy, called a colonoscopy, involves a small lighted tube being directed through the anus, rectum, and colon. Small pieces of tissue are collected. The collected samples are examined under a microscope by a doctor called a pathologist who looks for immune cells such as eosinophils and other signs of disease. Eosinophils are white blood cells that are normally found circulating in the body. However, in EGID, these cells collect and build up in parts of the GI tract. These cells are associated with tissue swelling, inflammation, and damage. It is normal to have some eosinophils in the stomach, intestines, and colon, but when there are higher than normal amounts found in one or more parts of the GI tract, an EGID diagnosis is considered. A doctor will use symptoms, visual evidence from the endoscopies, and the pathology report to arrive at a diagnosis. EGID are typically complex, lifelong conditions. These chronic disorders can flare up or go into remission. Care for EGID is best managed by a multidisciplinary team that includes gastroenterologists, pathologists, allergists, and dietitians, with all treatment decisions being made in partnership with patients and families. EGID can be successfully managed with medicines or dietary therapies. Medications can include glucocorticoids or biologics. These are medications that counter immune responses in the body, like inflammation. Dietary therapies involve avoiding the triggers, such as foods, that cause inflammation and disease flare-ups. Ongoing research efforts are improving diagnosis and treatments for EGID and give hope for better treatments and an eventual cure.